So we're going to talk about brow lifting and the basics of brow lift surgery. The first thing to really discuss is basically the anatomy of the eyebrow and what we're trying to change by doing something like brow lift surgery. So the important thing to think about is that there's really the entire length of the brow. It's not just trying to lift it in general. You really have the medial aspect here of the brow, and then you have the lateral aspect here of the brow. So you'll find that some patients have the entire brow that's low on their forehead. Sometimes they'll have just the medial aspect that's lower or the lateral aspect that's lower. And so you really have to kind of figure out what each patient has and what anatomy you want to change by doing a brow lift surgery. But overall, in general, men tend to have their brow position at the level of the bony orbital rim, so right here, and females tend to have the eyebrow position slightly above the bony orbital rim. And as we age, we tend to have our eyebrows drop. And so when the eyebrows tend to drop in position, this also then can contribute to some of the upper eyelid skin that can be a little bit excessive, and those two things together can give a really heavy appearance to the eyes and to the eyelids and make people look very tired and or very angry. And so the one thing we can do is we can obviously remove the excess eye skin, but really to get a nice rejuvenated appearance, we can raise the position of the eyebrows into a more youthful and rejuvenated position. And so by doing that, we really have to do brow lift surgery, and there's really no other way of doing that. Things like Botox or other things like that, by placing a little bit of Botox here, it can give a slight little bit of elevation, maybe in the order of 1 or 2 millimeters, but it really won't raise the position of the eyebrow into a really noticeable difference that's long lasting. And so again, things to think about are the position of the eyebrows for each patient, what we're trying to lift. Are we trying to just lift the medial aspect or the lateral aspect? Again, another thing that you'll see is that over time, the tail or the lateral aspect of the eyebrow tends to fall down and tends to droop. And this is something that gives a pretty aged appearance, as well as when the temples get hollow too. This contributes to the droop of the lateral eyebrow, and that's something that people want to change. So when we're talking about brow lift surgery, important things to consider are 2 things. So number 1, the position of the hairline for the patient, and then also the length of the scalp. So does someone have a short forehead, or do they have a very long forehead? And if they have hair at all. So those are the 2 things that are really important, because you can change the position of the hairline in either a desirable or an undesirable way. And then also, if someone has a really short forehead, you wouldn't want to make it shorter. And so when you talk about the surgery itself, there's a lot of different approaches. There's a long history of brow surgery. The old-fashioned way was kind of making an incision back along the hairline from ear up here all the way back here. You'd be able to go down all the way and really get direct access to release everything and lift the brows. But this is, a very big incision. It's in the hairline. It created a lot of numbness in the scalp. And it's something not as done as often as it used to be. Another approach that's very commonly done is an incision either in front of or just behind the hairline. And so this has advantages too, so you can really get a lot of nice exposure directly down into the eyebrows coming from those incisions. And then they can also hide themselves very well within the hairline or just in front of the hairline. And this can also allow you to modify things like lowering the hairline or even shortening up the forehead if you'd like to do that. And another really popular approach is the endoscopic brow lift. And so in this procedure, you're really not modifying the length of the forehead or the hairline at all, but what you're doing is you're making small little incisions behind the hairline here, and then you can make smaller incisions behind the hairline here as well. And using a camera, you can come from this area in the scalp and get all the way under camera guidance, almost like a video game. And you can release all the attachments to the eyebrow here, just as you would do in any other kind of brow lifting surgery. And then at that point, what we're trying to do is lift up and hold up the brows in a new position. So in this surgery and others, really the important thing is once we've lifted the eyebrows, we want to keep them there in the new position. There is a number of ways to do this, especially in endoscopic brow lift surgery. The idea of how do we fixate things is really important. So some people will just kind of drill a hole and secure it with a big thick suture to hold it up in a higher spot. Some people use screws and try to hold things up that way. Some people just even put glue in and try to hold it with some tissue glue up there. But one thing that I think people overall say is that it's really not the method of how you try to hold things up. It's really about releasing all the attachments of the eyebrow. And so the eyebrow is really attached all around here and has a lot of attachments to the skin and down to the bone. And so if you really do a good job of releasing those attachments in the surgery, then it's really going to allow the brow to elevate and stay elevated and not drop over time. And so the recovery from brow lift surgery depends on the approach. You get a little bit less bruising and swelling when you have a more minimally invasive approach like an endoscopic brow lift. You're going to have a little bit more of a recovery, but not much more when you have a little bit of a larger incision. You have more of an incision care to do because you have something that's either coming along this way or along the hairline. But typically you go home with a dressing. You'll have to be able to take that dressing off and then take care of the incisions that you have. The majority of the swelling will go away in about a week or two, and then it's just taking care of things and seeing how the result holds up over time. If you guys have any questions about brow lifting surgery, please let me know, and thanks for watching.